Assalamu alaikum and welcome back. In previous video of ECG changes due to electrolyte imbalance, we discussed about ECG changes due to hypokalemia and hyperkalemia, and we also discussed about ECG changes due to hypocalcemia and hypercalcemia. आज के इस वीडियो में हम बात करने वाले हैं अबाउट ECG changes due to hypomagnesemia and hypermagnesemia. फर्स्टली अगर हम देखें नॉर्मल मैग्नीशियम लेवल्स इन आवर बॉडी, तो नॉर्मल सीरम मैग्नीशियम लेवल्स जो है दैट इज़ फ्रॉम 0.8 टू 1 मिली मोल पर लीटर. नाउ अगर हम बात करें अबाउट हाइपोमैग्नीसीमिया की, तो इन केस ऑफ हाइपोमैग्नीसीमिया इफ द लेवल्स आर लेस देन 0.8 millimoles per liter, it's hypomagnesemia, and in hypermagnesemia if the levels are more than 1 millimoles per liter, it is hypermagnesemia. अब हम पहले अगर देखें हाइपोमैग्नीसीमिया में, we define it as levels less than 0.8 millimoles per liter is associated with QT interval prolongation and an increased risk of ventricular arrhythmias. Patients with hypomagnesemia often have concurrent hypokalemia and or hypocalcemia and associated ECG features of these conditions. Now, in clinical relevance, correction of serum magnesium to more than 1 millimoles per liter with concurrent corrections of serum potassium to more than 4 millimoles per liter is often effective in suppressing ectopy and supraventricular tachyarrhythmias. A rapid IV bolus of magnesium 2 gram is a standard emergency treatment for torso D points. Now, in ECG changes in isolated hypomagnesemia, we see that prolonged PR interval is seen, prolonged QT interval, atrial and ventricular ectopy, predisposition of ventricular tachycardia, and torso D points are seen. Let's see the examples of hypomagnesemia. In this case of ECG, we can see the prolonged QT interval. And in another example of hypomagnesemia, torso D points can be seen, as you can see here, and it's also associated in hypokalemia. Now, in hypermagnesemia, we say ECG changes include prolongation of PR interval, increased duration of QRS complex, and prolonged QT interval. These changes are often associated with hyperkalemia. Usually, hyponatremia and hypernatremia do not have any direct effect on ECG. However, ECG changes may be seen in some cases and are often associated with other electrolyte abnormalities. Now, here I have given some ECGs, and pause this video and try to analyze these ECGs by your own.
Subscribe, learn with SD, and press the bell icon. Don't miss any update. If you like the video, please share with your friends.